Pericardium is a fibroserous sac that encloses the heart and roots of great vessels. If we talk about the functions of this pericardium or fibroserous sac, it actually restricts the excessive movements of heart during systole and diastole. And it also acts as a lubricated container in which the different parts of heart can contract. And what is the location of pericardium? Obviously, location is the same as of heart itself, as the heart lies in the middle mediastinum, posterior to the body of sternum, and extent is from 2nd to 6th cartilages and anterior to 5th to 8th thoracic vertebrae. So you can see from this diagram, pericardium is a double-layered membrane or sac that surrounds the heart. It has 2 layers actually. The outer layer that covers the heart is the fibrous pericardium. And if we dissect the pericardium and see internally, another glistening layer is attached to the fibrous pericardium internally, and that is the parietal layer of serous pericardium. Then comes the pericardial cavity, which is a slit-like space, and then the visceral layer of the serous pericardium, which adheres to the muscles of heart. So we can see that the pericardium is divided into 2 layers. Outer one is the tough fibrous pericardium, and inner one is the serous pericardium, again divided into parietal and the visceral layer. Visceral layer is also called the epicardium. Then comes the myocardium, the muscles, and then the endocardium. Then comes the cavity of the heart. So if we talk about fibrous pericardium, it is a strong fibrous part of the sac, outer covering, which is firmly attached below to the central tendon of diaphragm. And it is almost inseparable from the diaphragm. Then superiorly, it fuses with the outer course, that is the adventitia of the great vessels that pass through the heart, that is aorta, pulmonary trunk, superior vena cava and inferior vena cava, and the pulmonary veins. And then it is continuous with the pretracheal layer of deep cervical fascia of neck. So it is continuous inferiorly with diaphragm and superiorly with the great vessels, and anteriorly you can see that it forms the sternopericardial ligaments to be adherent with the posterior aspect of the sternum. Then serous pericardium, when heart grows during the embryological life, heart invaginates the pericardial cavity and takes along a layer with it, that is the visceral layer, and then the parietal layer is separate through the pericardial cavity. But at the root of the great vessels, the parietal layer is continuous with the visceral layer. Now, this is the fibrous layer, and internally it is the visceral layer. Again, you can see this is the parietal pericardium, then the pericardial cavity, and then the visceral pericardium. Actually, it provides cushion for heart too and lubricates the heart during the contractions. So, what are the pericardial sinuses? So, the pericardial sinuses are nothing but reflections of serous pericardium on posterior aspect of heart. Heart starts developing as an elongated tube. You can see this is the heart tube with arterial end and venous end. Then the venous end starts moving superiorly and to the right towards the arterial end, and then the transverse pericardial sinus begins to form. So you can see here That arterial end, which includes the aorta and pulmonary trunk, they lie anterior to this transverse pericardial sinus, and large veins, they lie posteriorly. And if you want to insert fingers through this space, you can. Actually, the surgeons, they put their fingers in this sinus to get the large vessels ligated during the coronary artery bypass grafting, that is CABG. Then during the development and movement of the pulmonary veins, the oblique pericardial sinus is formed, which is formed between the pulmonary veins and the inferior vena cava. They lie lateral to this sinus. And posteriorly, there is pericardium covering the esophagus. And actually, it is a blind sac, cul-de-sac, which can't be extended superiorly. Then, as I have already told you that the surgical significance of transverse pericardial sinus is that the cardiac surgeons, when they open the pericardial sac, a finger is passed through the transverse pericardial sinus posterior to the ascending aorta and pulmonary trunk and in front of the superior vena cava. By passing a surgical clamp or ligature, they ligate the vessels to stop the circulation of blood, or they can divert the circulation of blood to perform the coronary artery bypass grafting. So what is the arterial supply of pericardium? Pericardium is supplied through internal thoracic arteries branch pericardiophrenic artery, which descends with the phrenic nerve. And pericardiophrenic artery, it is a branch of internal thoracic artery, which in turn is a branch of first part of subclavian artery. And they both go towards the diaphragm. Then the musculophrenic artery, you know that internal thoracic artery terminates by giving two branches. One is musculophrenic artery and second is the superior epigastric artery. So musculophrenic artery, when it follows the costal margin, it also gives the branches to the pericardium. Then additional branches, they include bronchial, esophageal, and superior phrenic arteries, which are branches of thoracic aorta. And coronary arteries, which supply the muscles of the heart, and the visceral layer of serous pericardium is the only layer that is supplied through the coronary arteries. And these are actually the first branches of aorta, the coronary arteries. And what is the venous drainage? Venous drainage of pericardium is through the pericardiophrenic veins, which are the tributaries of brachiocephalic or internal thoracic veins. And they can also drain into azygous venous system. If we talk about the nerve supply of pericardium, pericardium is supplied through phrenic nerves and vagus and sympathetic trunk. The fibrous pericardium, that is the outer layer, along with the parietal layer, which lines the fibrous pericardium internally, these are supplied by the phrenic nerve. Now, the nerve root value of phrenic nerve is C3 to C5, and it carries the pain sensations, which are commonly referred to the skin of the supraclavicular region on the same side. That is the top of the shoulder of same side. So if there is pain originating from the pericardium, it can be referred to the shoulder or supraclavicular region because of the same root value region. So then comes the visceral layer. Visceral layer is supplied through the vagus nerve and sympathetic trunk. Sympathetic trunk is vasomotor to the visceral layer. Talking about the clinical aspects of pericardium, inflammation of serous pericardium is called pericarditis. Pericardial fluid may accumulate excessively. Normally, only 50 ml of pericardial fluid is there in the pericardial cavity, but if excessive amounts are accumulated in the pericardial cavity, this condition is called pericardial effusion. Then this pericardial effusion or excessive fluid, it can compress the thin-walled atria and interferes with the filling of the heart during diastole. resulting in reduced cardiac output. This compression of heart is called cardiac tamponade. So one condition which leads to cardiac tamponade could be pericardial effusion or the inflamed secretions. If there is stab or gunshot wounds, it can also result in cardiac tamponade when the heart is penetrated and blood escapes into the pericardial cavity. The mechanism is the same, that accumulation of blood in the pericardial cavity restricts the filling of heart, resulting in decreased cardiac output. Then after MI or heart attack, there is rupture of weakened muscles. Again, the process is the same. Non-inflammatory pericardial effusions often occur with congestive heart failure, in which venous blood returns to heart at a rate that exceeds the cardiac output, which results in right cardiac hypertension and elevated pressure in the right side of the heart. So if there is a pericardial effusion, we will go for pericardiocentesis. It is the removal of excessive amounts of pericardial fluid accumulated in the pericardial cavity. So we have to aspirate that fluid from the pericardial cavity. For that, we have to get into the pericardial cavity, and we'll choose a site to insert a needle. So we will insert the needle through the left of the xiphoid process, and the needle is directed upward and backwards at an angle of 45 degrees to skin. In this way, we will avoid to puncture the pleura and lungs, because there is a cardiac notch present in that area, and we are directly going into the pericardial cavity by piercing the pericardium. If we discuss some of the MCQs at this stage, it will clear your concepts more. So number one is, if a 35-year-old man is brought to emergency department after a stab wound to the left side of chest, he develops hypotension, distended neck veins, and muffled heart sounds. Emergency pericardiocentesis is planned through the left infrasternal angle. Which structure must the needle pierce immediately before entering the fibrous pericardium? So you must know the layers of skin to be layers from skin to deep to be pierced to reach the pericardial cavity. So question is that which structure must the needle pierce immediately before entering the fibrous pericardium? Central tendon of diaphragm, internal thoracic artery, left lung and pleura, left phrenic nerve, or costo-mediastinal recess. Out of all these, answer is central tendon of diaphragm. Next one is, during coronary artery bypass graft surgery, the surgeon passes a vascular clamp behind the ascending aorta and pulmonary trunk, but anterior to the superior vena cava. The clamp is passing through which anatomical space? Obviously, it is transverse pericardial sinus with anteriorly placed aorta and pulmonary trunk, and superior vena cava is the posterior relation to this sinus. Then MCQ number 3 is, a cardiac surgeon inserts a finger behind the left atrium during mitral valve surgery. The finger enters a blind-ended recess bounded by pulmonary veins and inferior vena cava. So this is also an easy one. Answer is oblique pericardial sinus, which is a blind-ended sac or recess bounded laterally by the pulmonary veins and inferior vena cava. Then a 40-year-old male presents with acute viral pericarditis. He complains of severe central chest pain that radiates to the shoulder. Examination reveals a pericardial friction rub. The referred pain is carried primarily by which nerve? So if you know the innervation of pericardium, you will get to answer this question. So the answer is obviously the phrenic nerve, having root values C3, C4, and C5. Last one is that a junior doctor performs a pericardiocentesis by inserting the needle through the left fifth intercostal space close to sternum. Now, this is the parasternal region. During the procedure, brisk arterial bleeding occurs due to injury of a vessel running vertically along the posterior surface of anterior chest. Which vessel was most likely injured? So, as we know that the internal thoracic artery, it descends on both sides of sternum. So, answer is C, that is internal thoracic artery. So, this is the end of our lecture. I hope your concepts are clear. Thank you so much.